Integration working will mean that the knowledge and expertise of the people in each agency will be brought together, and that can only be good for the people of South Lanarkshire. It will mean a more seamless transaction between health and social care, which the people of South Lanarkshire will really benefit from.
Partnership working is really what it's all about. I think it's what it's always been about, but it's ever more important now that we move towards an integration agenda. Particularly given the real challenges around resources, it's very important that we're all working together to make the most efficient use of resources. But maybe more importantly than that, it's about the difference that it will make to the patients and the carers and the families that we're working with.
Partnership working is very important to the Carers Network. It's a campaigning organisation for unpaid carers, and through integration we want carers to be recognised as equal partners throughout the integration process.
Partnership working and integration, I think, is just absolutely the way forward. I've had a lot of experience over the years in various partnerships, particularly with South Lanarkshire, Local Authority and NHS Lanarkshire, and not forgetting obviously the third sector. So I absolutely can see this is a way of putting this on a very formal and firm footing and giving us a strategic direction.
Partnership working is critical, I believe, to release the potential for a range of provisions from statutory and third sector organisations, services that will provide a wider range of available supports for service users and also provide a more cost-effective approach as the public services reforms change the landscape of health and social care.
The benefits of partnership working is obviously because we're working with people, working with other agencies, it's ensuring that we're getting the best outcomes for the person involved, whether it's getting them home care or getting them other services or getting them services from health that's going to help them remain at home.
The benefits of partnership working, they're there for everyone to see. We would work as a multidisciplinary team providing palliative care to people at the end of their life. We won't have everybody working at Kilbride Hospice. We'll be dependent on our partners at NHS Lanarkshire for some of that role, and also when patients get home we'll be dependent on the community nurses and GPs to provide that service. It may be that patients will come back into the hospice for their end of their life, but that's how we see it in the future.
It is very important that partnership working, especially we have experience in the health sector, but it's very important now that we embrace the social work part of it, the social care part of it.
When integrating two massive bodies such as South Lanarkshire Council and NHS Lanarkshire, I think it would be quite easy to get stuck in the bureaucracy of things, and it would be quite easy to forget that the people in the community are actually the centre of what we're wanting to do.
There are a lot of challenges to the new agenda and a lot of challenges to working partnership. I think one of the main ones is the dynamic and the balance between the competitive and collaborative aspect that's required. You have a lot of different agencies, organisations who have their own remit to deal with clients, and somehow we all have to come together and keep looking at the bigger picture, still focusing on our own clients and the purpose that we're there for, but also really look at how we can effectively work together to meet the bigger picture.
There's two different management structures coming together, and two very differing pathways are coming together. I see that there are going to be challenges there, but with events like this morning, where we're all sitting around the table putting our thoughts on paper, then that's going to smooth out.
I've been involved in a lot of integrated, co-located teams, and the biggest challenge I've always found is the change in attitudes and cultures. You will get people who are absolutely up for this, who will drive this forward, who will say this is nothing new from what we've been doing on the ground for many, many years. But there's others who will still have that bit around their own personal identity and worry about that. And you have to win hearts and minds over to get the real buy-in from people.
The actual integration element of it at the moment, I haven't seen many massive challenges. I think the issue is aligning the third sector, the voluntary sector, to the timescales of the integration board itself. It's ensuring that we can follow that pace and that we've got appropriate forums in place to match and to feed into those integration boards.
When you look at the statistics, Clydesdale is unique in Lanarkshire. That's certainly unique in South Lanarkshire. So I think it's important that kind of voice from the bottom, from the community up, is there from the start in planning the delivery of services for that area.
Even at this early stage of integration, I'm particularly proud of the fact that we've now got 80 new home carers, which will mean that people who are in hospital will be able to get out quicker because there is that extra home care. I'm also particularly proud of the Forward Thinking Hospital at Home scheme, which will mean that consultants and nurses and GPs will be able to be set at home for the most vulnerable people in South Lanarkshire, which will save them getting into hospital. That is now available in South Lanarkshire, all through integration and integration money, which is really good.
Within the Haven over the last few years, we've had a really fantastic partnership that's been going. It's been between ourselves, St Andrews Hospice and Kilbride Hospice, and it's been very much supported by the Reshaping Care for Older People agenda. That partnership's allowed us to develop a service that provides palliative care for patients and carers within their own home right across South Lanarkshire. And it's something that individually each of the organisations wouldn't have been able to achieve by themselves, but working together and with the support of the Reshaping Care Partnership, we've been able to really develop a service that's enabled much more equity of access to this really vital support for families across the whole of South Lanarkshire.
I can tell you lots of positive examples over the years I've worked with, in particular between the NHS Greater Glasgow and NHS Lanarkshire, but also very much so with South Lanarkshire Council. And now we've got the telehealth and telecare programme, and now the technology enabled care programme funded by Scottish Government, which is about remote monitoring of telehealth. And again, that really has to fit with whatever our social work colleagues are doing as well. We can't be in isolation at any time. The care in the community absolutely needs everyone working together.
We had a lady who came out of hospital, quite an elderly lady, and her outcome was to obviously get back driving her car. She went into hospital with a bony injury. So we made sure that the carers knew what her outcomes were. She was getting input from the ICST, she was getting occupational therapy and physiotherapy, coming in a few times a week to obviously work on the lady at home. But every day she was seeing home carers coming in and they knew what her outcomes were. So they were keeping her outcomes in the forefront of her mind every day. If we work towards this, this is going to be your goal. And the lady eventually stopped home care, got back out in her car, and that was the outcome that she wanted.
This is a massive change for the staff, for the public, for the third sector, for the independent sector, and I think it's really important that the board remember to bring these people with us, and I think that it'll entail a lot of open-mindedness from everybody who is involved in integration.
I think what matters to me personally is that there's a public voice in there, and certainly as part of the commissioning group, which will become the planning group, I feel that I have a place, I have a seat at the table. The obligation is now for me to feed back to the public and the community, and our own group, Clydesdale Public Partnership Forum, are looking at ways of doing that in a better way than we've done in the past.
One of the things that matters most to me as we go forward is that we don't forget about the voluntary sector and third sector organisations. There are a lot of organisations working here who want to have their voices heard. So while I'm saying it's important we don't forget about the third sector, I also recognise the challenges in pulling together all those different voices and the diversity of that to meet with the health and social care partners.
What matters most to the Carers Network through integration is that carers are recognised as equal partners in the delivery of care and in the planning of services through integration.
What matters to me most is that we are kept absolutely informed in understandable language. I've appreciated the newsletters that have been produced because I think they're a nice wee bite-sized. I think these events like we're having today in the localities is absolutely crucial, and I think it'll be really interesting to hear not only from staff but from patients, service users. We have to know what's happening from a ground level up and backwards.
Basing it on the third sector's input to this, I think it's important that we work with statutory services, with that partnership, to provide the most appropriate cost-effective supports from a range of partners, but also utilising the skill levels and the professionalism of the sector.
The most important thing to myself is keeping good communication links between everyone involved, whether that's working with other agencies or whether it's working with the person that's at the centre of what we're trying to obviously get the best outcome for.
What matters to me is that we keep the patients uppermost. People only get the end of their life once, and we want to make that the best for them and their families. So that's what matters.
I would say community-based care is probably the best way to describe integration.
If I was to describe integration in 3 words, I would probably say it's complex, but also that it's simple and that it's vital.
To summarise integration in a few words, I would say it's good sharing of information and skills.
Better integration in 3 words to me means better improved outcomes.
For me, it's working in the community.
Integration to me is patients' needs first.
3 words about integration: joined up working.
If I was to sum up the integration process in 3 words, I would say it would be collaboration, cooperation and innovation.
One of the things we've done over a number of years in South Lanarkshire is to concentrate on what we call involvement engagement, not to think about consultation in a formal sense, because if we involve people, whether it's carers, service users, patients, the third sector, the private sector, as well as partners who work in health and social work in the council and other parts of the council, including housing, then I believe you get better outcomes from that from the point of view of how we work together. Because by listening to that, there's a better chance we'll get it right more often.